Hi, I'm Dr. Martin Rutherford. I am a certified functional medicine practitioner and a chiropractor since 1980. This is Dr.
Randall Gates. I'm a board-certified chiropractic neurologist and also a chiropractor.
And today we're going to talk about irritable bowel syndrome, but we're going to talk about some of the new updated literature and what that means in English. We're going to talk about some new things that people who have been diagnosed with irritable bowel need to know about. We have a practice here in Reno, Nevada, in which we have married our two paradigms, functional neurology and functional medicine, into what is proving to be a consistently successful approach for many chronic conditions and many chronic pain conditions. We most notably treat peripheral neuropathy. We treat lots of fibromyalgia, restless leg syndrome, dizziness, vertigo, balance disorders. We just did a 40-minute talk on balance disorders prior to filming this. Concussions and several other neurologically based and metabolically based issues, and we're getting pretty successful results. As a result, not knowing where this was going in the beginning, we have found that we had to become very conversant in things like autoimmune problems. We found that we had to become very conversant in every aspect of thyroid problems, stress mechanisms in the brain, and one of the big breakthroughs during my period of time in doing this type of treatment was to become aware that many of these issues have contributions from bad intestinal problems, and so once we started to understand that, once we started to really give a lot more attention to the intestines, more so than just the basic diet and okay, do this diet, do a cleanse, do a liver cleanse, or do this, or whatever. Okay. Once we started really getting into it, we started seeing dramatic changes in our patients' wellness, and how much they got better, and how quickly they got better. And the most we were just talking about balance disorders in a previous talk, and everybody comes in with balance disorders. Everybody's been told they got BPPV. This is something where you got rocks in yours. Well, to relate to irritable bowel syndrome, everybody's got intestinal disorders, it seems like, comes into our office and told they have irritable bowel syndrome. It's a very catch-all term. I really don't know that it has, I guess it has a specific meaning, but it seems like that's the meaning that is deferred to when pretty much nothing else can be found. And it's a big part of our practice, is treating people who have been diagnosed with irritable bowel syndrome. There are some very new studies that correlate with things that we have seen. And so Dr. Gates really felt strongly that this is something we should share with you so that you can have some confidence to go forward with your doctor or with some doctor or on your own, or with attempts to help yourself there. And we think that these new data give a lot of validation to the types of protocols that have been developed here in our profession, and maybe will give you some confidence to go forward with some of the things that you've been exploring.
Exactly. So if you are looking for a foundational piece of information, we did an IBS talk back last spring sometime. So we talked extensively about how IBS is multifaceted, from the elements of stress, the brain's impact on IBS patients. Talked about how upwards of 20% of the population has IBS, as you're referring to. Talked about how there can be bacterial overgrowth in the intestines associated with IBS. That's the new thing. Talked about food allergies. Talked about how the bacterial overgrowth can be different, whether you have IBS type C, which is where you have constipation, versus IBS type D, where you have diarrhea, on and on and on. So if you want to access that, go to powerhealthtalk.com. As Dr. Rutherford mentioned, we're going to be talking today about some of the emerging literature. Let's first talk about this really cool article out of Current Treatment Options in Gastroenterology. It was published on September 16th of this year, and it's termed Dietary Renaissance in IBS, has food replace medications as a primary treatment strategy. We love it. And there they talk about...
Which is the vast majority of our treatment.
Yeah. And there they talk about how really healthcare providers are not schooled as well in these dietary strategies for IBS. And they actually poo-pooed them for a long period of time, and now they're really seeing the credibility with which someone can be treated for IBS largely through food or natural measures, really.
Yeah.
And so that's not a cut on your gastroenterologist, because they're really smart people and bright people, but they're trained in a certain model of medications, surgeries, things of that nature. And especially because IBS is the most frequent thing they see, they wrote this article to say, hey, we need to look at something simpler in terms of a treatment model. Now, the reason why diet is so imperative for IBS is because we talked about that bacterial overgrowth. We're seeing that certain foods, certain types of carbohydrates feed those bacteria. And yes, there can be other components, like I talked about, small intestinal bacterial overgrowth, which may be even a little different than what we're talking about here, or maybe kind of a spectrum. We're talking about food allergies, all this other stuff, but what we're seeing is that certain foods feed these bacteria, and if you eliminate those from the diet, lots of times IBS symptoms can get better because the bacteria start to die off, and that decreases inflammation. Another thing you as an IBS sufferer may have read about is the drug rifaximin. Rifaximin is a medication, it's an antibiotic that does not absorb through the gastrointestinal tract, so it acts locally in the GI tract itself. And they have done many studies where they're saying, we give this person rifaximin, all of a sudden their IBS or their IBS symptoms have gotten better. Well, now they're doing more detailed studies, and if you want it, it's out of Gut Microbes 2014 in July, where they show exactly that this rifaximin is killing these bad bacterial populations in the intestines. This relatively newly recognized or acknowledged group of bacteria called the segmental filamentous bacteria. They create a lot of inflammation in the gut, and the rifaximin wipes them out and decreases inflammation and decreases leaky gut syndrome. So you can see our talk back in...
But if you take the rifaximin without finding out what the foods are that are feeding it, that are perpetuating it,
then basically it's probably be a temporary solution. And so
temporary solution.
And so that's what we've seen clinically too, because we're not anti-medicine. If a patient has a severe case of small intestinal bacterial overgrowth, we'll refer them for the medication. And so if you want these articles, just email us or contact us at powerhealthtalk.com. I have 5 here that are brand new, that are really cool relative to the IBS sufferer. But know that if you have IBS out there, that there are treatment options for you. Lots of times they're natural. You can talk to your doctor about them. You can message us at powerhealthtalk.com, and we'll get back to you and let you know what's going on.
Yeah.
Okay.
Yeah, that should be a valuable piece of data for those of you who have IBS. If you didn't get that was a valuable piece of data, replay this and look at some of these articles, and because it really is a big, important piece of information for those of you who are struggling with this condition.
And speaking from experience, I had IBS. Technically, we can't say that you had IBS.
Yeah, well, I tested positive for celiac, so I have celiac. He has IBS. We kind of have a little bit of a background with intestinal problems.
We have some vested interest in it.
Vested interest, exactly. So we're hoping to help you out, so that you can have the same results that we've had and that our patients get. So, okay. Till next time, I hope that was good for you.
And thanks for watching.
Yeah.